2021, DCC began using CARSA funds to pay the parent copay amounts. This costs the state approximately $1.5 million in federal funding per month and has increased eligibility, and program participation has also increased. Copayments for families have lots of variables, which include household income, household size, the type of provider the family chooses, the location, whether it's rural or urban, the age of the child, and the number of children in the home. The copay is set as a daily rate, so every family has a different copay based on their individual situation. So that makes it really hard for us to estimate future copayment amounts because there's so much fluidity from family to family. But we have also estimated the physical impact of discounting copayments for families with multiple children in child care and produced estimates of approximately $260 in savings for a 20% copay discount for enrolled families at an annualized estimated cost of approximately $2 billion. There are many child care programs across the state that give tuition discounts to siblings. The more kids you have attending, the bigger the discount, but that's a small business decision, and that's not something the cabinet requires or that we track. So, goes without saying that the cost of child care is expensive. And it's not that the child care business is making big profits. Many are hardly making a profit at all and have really struggled for a long time. Even before the pandemic, child care providers operated on a razor-thin margin. I mentioned the new transitional exit period from the program that we began in March, again funded by federal dollars specific to child care. Through June, 37 families or 56 children were deemed to have incomes too high to participate in the program, but were provided with 50% assistance for 3 months while they got used to paying for child care costs. In July, we added another 34 families, which was 55 children. So in 2 months' time, we have added 71 families and 111 children that wouldn't have benefited from this before. And again, given those numbers, most families have more than one children that they're paying child care for. So again, that's a $1,500 bill that they have to absorb on their own overnight, essentially. Effective September 1st, we have extended that transitional period from 3 months to 6 months, again, using federal ARPA funds because we recognize this is a huge adjustment for working families and a huge hit to their budgets.
So, as we continue the discussion of public assistance programs and benefit cliffs, let's take a look at SNAP, the Supplemental Nutrition Assistance Program, formerly known as food stamps. You heard Andrea speak about the fluidity of Ccap and how things change day to day. We see that in other programs, including SNAP as well. There's an assumption that people who receive SNAP stay on it for years, but that isn't what the data shows us. Nationally, studies show that 74% of adults receiving SNAP worked in either the 12 months prior while they were receiving SNAP or within 12 months after. 2/3 of recipients received SNAP for less than 2 years. And most of those who receive SNAP the longest are what we refer to as the working poor, many of who are working or trying to work but have unstable or unreliable employment. According to USDA data from 2018, of households receiving SNAP, a third had at least one member aged 60 and up, about half contained a child under the age of 18, over half contained at least one disabled individual, about half had one wage earner in the last 12 months, and a quarter had two wage earners in the prior 12 months, indicating something had happened to decrease their income during that period. We all can recognize that economic conditions influence SNAP participation. As an example, we can look at the 2009 recession and recovery. SNAP caseloads climbed as 2009 recession, and so SNAP caseloads climbed as jobs became scarce and wages were low. At its peak in July 2013, in Kentucky, SNAP served just under 880,000 individuals. As the state began to recover from the recession, 3 years later, participation was down to just over 670,000 individuals, or a reduction of 25%. And currently, participation in SNAP in Kentucky is about 547 individuals, or about 250,000 households. And here is a visual demonstrating what we just discussed. The orange line you see is the number of individuals receiving SNAP, and the blue line depicts the number of households receiving SNAP. And this data is for federal fiscal years 2008 through 2016. You see the peak of the recession at 2013, at which time there was, again, 880,000 individuals that were receiving SNAP, and the decline of SNAP participants each subsequent year of the recovery. Like the recession of 2009, we've seen similar trends with the recent pandemic. We would note here that both during the recession and COVID, we've seen related SNAP participation reduction occur with no mandatory work requirements, and individuals went back to work when jobs became available. Again, here you just see a visual showing the SNAP participation trends for both individuals and households during COVID. As you can see, Kentucky's SNAP participation today has nearly returned to pre-pandemic levels. The data shows us that as employment opportunities increase, SNAP utilization decreases. You have a percentage of recipients who are staying on the program, and most of those, as we indicated a minute ago, are working poor. But for the most part, people are utilizing this assistance in times of greatest need, which is what these safety net programs were created for, and indicates that the programs are working as intended. SNAP, Child Care Assistance, and Medicaid are the first benefit cliffs experience for individuals and families making their way out of poverty. And you'll see this in a simulator example later in the presentation. Again, 74% of SNAP recipients have recently worked, are working, or started working soon after receiving benefits. And approximately 20% nationally and in Kentucky are not working. The reasons cited for not working include caretaking responsibilities. We already discussed the high cost of child care and how that impacts individuals' choices around work. What we didn't mention is about the fact that 50% of our state is in a child care desert, which means there is an insufficient number of child care providers or slots for the children in that community. In addition, some individuals have responsibilities caring for elderly parents, health conditions, low educational attainment, and homelessness were also identified as barriers to work. To address these and other concerns, we are fortunate to have community partners doing a great job to help address barriers to work. You'll hear from one of our SNAP employment and training partners later in today's meeting, and we'll let them share the great work that they're doing in this area.
We were also requested to present on a benefits cliff calculator. House Bill 7 from this past session required the Cabinet to develop a proposal to make a benefits cliff calculator, an online jobs posting database accessible to the general public and to public assistance recipients. This proposal was submitted to the LRC at the beginning of this month. If you would like to read about it in more detail, I noticed that it has been loaded into the meeting materials on the LRC webpage for this task force as well. The Kentucky Center for Statistics, Kentucky Stats, presented to this task force in July on their Family Resource Simulator, which is a tool already accessible to families, employees, and employers. The purpose of the Family Resource Simulator is to assist individuals in understanding the potential impact of changes in income or in employment to the public assistance benefits the individual or family may be receiving. Rather than invest additional time and money creating an all-new calculator, the Cabinet is working with KY Stats to increase the functionality and ease of understanding this Family Resource Simulator for public assistance recipients and their employers. I've included a link if you would like to check out this family resource simulator yourself if you didn't already do so in this interim. This tool is already being used by workforce partners such as Kentucky Career Centers, Bluegrass Area Development District, Metro United Way, Community Action Agencies, Goodwill Industries, and more. Public assistance case managers also use the simulator to assist individuals who are looking for work or who need assistance determining how a new job or promotion may impact access to needed services. Additionally, human resource professionals and employers also use this tool to target salaries that may smooth over those benefits cliffs, so they know what salary their employee may need to reach to kind of offset the benefits that they may lose. In its first month since launching in July, the tool was utilized over 1,100 times. The proposal we submitted uses the scenario that I've included here in this graphic, where the family will experience 4 benefits cliffs as their income increases. In this scenario, the family loses SNAP, again, assistance in purchasing food, with just a $2 per hour raise. In July, Kentucky Stats took you through a simulation that identified benefits cliffs a family would experience as their household income increased. They produced 6 scenarios representing 250,000 Kentucky families with varying components to the family depending on how many parents were working, how many children they had, and compared benefits cliffs that they would experience. In 72% of their scenarios, the family lost their SNAP benefits. In all of the scenarios, the parents lost child care assistance and some form of Medicaid assistance, either for the whole family or just for the children. So ongoing work. This is a great program. It's already easy to use and very informative. However, the Cabinet has identified some changes that we are working with KY Stats to help benefit public assistance recipients as they use the simulator, and our case managers as they use it as well. So phase 1 of the ongoing work, we estimate to be no more than $100,000, about 9 months worth of work. Kentucky Stats has been working with us and other organizations such as Goodwill and United Way to obtain feedback on the interface of the program. By July of 2023, KY Stats will upgrade the results page of the Family Resource Simulator to be more user-friendly. These changes include providing a profile of the family's income and expenses, bullet points that explain in sentence format at what income levels benefit cliffs may be reached, and the benefits that will be impacted at each of those points. The new format will also include links to KY Stats Occupational Outlook that provides information about job projections and wages through 2029, and to the LinkedIn job search database. During phase 2, the simulator will be integrated with the Connect benefits system, allowing individuals that are applying, reapplying, or currently receiving benefits to access the benefits cliff calculator with their personal information pre-populated based on the information provided in their public assistance applications. This will prevent individuals from having to enter the same information repeatedly and will improve the accuracy of the calculator's estimated impact on the family or individual. The Cabinet and KY Stats are still developing a total cost estimate for this work, but we've projected it to be approximately $130,000 with a timeline of approximately summer 2024. The Education and Labor Cabinet, through which the simulator is made available, also currently uses Focus Suite, an automatic job match engine containing a set of online tools for career seekers and employers. Career seekers can create a professional resume, search, apply for employment, and explore in-demand career paths and educational opportunities. Employers are able to post job openings and search for qualified candidates using this right now, today. This system offers a sizable job seeker pool. There have been 24,000 active job seekers accessing the site in the past 90 days. In addition to the Focus Suite, the Education and Labor Cabinet is adding a suite of tools from LinkedIn. These tools will allow recruiters to gain an understanding of the workforce and employment trends by region or by industry and create talent pool reports of current job seekers and company reports to understand employer and career seeker hiring trends. Cabinet for Health and Family Services will continue to work with Education and Labor Cabinet to provide a link from the online Connect portal to access these capabilities in focus suites and LinkedIn tools, making them available to anyone applying or reapplying for public assistance benefits, and really making it very user-friendly through Connect. Are there any questions?
Well, thank you. Thank you for that presentation very much. And does any of the members have any questions? Senator Neal?
Excuse me. Thank you for that information. I was struck, and correct me if I'm wrong, the ARPA funds related to the Ccap program seems to me that it significantly improved eligibility and access.
Yes.
That's correct. Is that enough? Does that reach the populations out there? Is there a significant population out there that it doesn't reach?
I think it's important to remember with Ccap, as far as like availability of childcare across the state, only 17% are to Ccap eligible families being used right now. There's probably more families that are eligible, and I think the more we can advertise and make people aware of the resources that are available, that we could see a great increase.
So I'm taking by your answer that there is a population out there that is out there. It depends on how we reach and make it available and they interpret it. May I?
You may.
Which raises a significant question in my mind. That ARPA funding is got to end at some point. Mm-hmm. So these improvements, which still, by my interpreting your response, fall short, suggests that there is going to be a question of sustainability. There's got to be you're talking about a cliff. There's got to be a big cliff out there behind that. Am I interpreting that correctly?
Yes, you are. And the Pritchard Committee did a survey that they had a press conference on earlier today. 500 providers responded about what the ARP funds have meant, but then what does it mean moving forward when they're gone. They've put out a lot of great information, and I would suggest, go check that out because it's very valuable.
Well, just one more question, Mr. Chairman. Then, and you may have just directed me to where I need to go, which I will go. Has the cabinet produced, analyzed, and projected a timeline as to when a crisis, that's what it sounds like to me, will occur if not for some intervention?
We are closely looking at that and trying to be innovative and creative about how we can approach that and hopefully mitigate that a little bit.
So we can expect that to be information available to us at some point?
Yes, sir.
In the near future?
In the future. I'm not sure how near, but yes.
Thank you so much. Thank you, Mr. Chairman.
Anyone else have any questions right now? All right. Well, I have a few, if I may. To Senator Neal, and he kind of ended it, but I just kind of wanted to touch on it again. That is a big cliff coming. Mm-hmm. So is there plans in the work? Does the cabinet actually have an idea of a plan to address that issue when those funds run out, or?
Well, I think, like Andrea shared, we'll be producing more information and looking at what that looks like. I know we'll be bringing that back to the General Assembly. We're also hopeful that there'll be some recognition on the federal level for additional support for Ccap, because this is not unique to Kentucky. This is nationally being experienced by every state. So again, we are collecting information. We will be sharing that with you all, and then as well, we're hopeful for additional federal support as well.
We do have this additional federal funding through September 2024.
Yes.
So we have a little bit of time to figure things out.
All right, thank you for that. With that, and correct me if I'm wrong, some of the ARPA funding is being used for the 50% extension as well, and that would be, I would guess, the same funds that are increasing the eligibility.
Correct.
So that would be one step, in my opinion, of kind of getting individuals off of assistance and helping with that cliff. I guess my question with that, and that lead-in is how long? It looked like maybe 3 months that's been going on, at the most 4 months. Have you collected any data? Have you seen any results from that, other than what was presented today? I mean, is there anything as far as individuals who took the 50%? Did it help them move off? Did you have any move off of assistance with that assistance kind of bridge there that was created?
I can't speak to their other forms of assistance, but with child care specifically, yes, it did help them, and it helped them prepare a little more. And hopefully the 6 months that we're going to be extending effective this month will also help them to be more financially stable moving forward.
Okay. And then I would follow that up with kind of a question. It's been brought up in this task force a few times, and that is, this is kind of an example of that, maybe is in a broader example, but a tiered system for some of these systems, where there's a bridge instead of an abrupt stop. There's a bridge moving forward, and kind of what is done here with this. And so my question, I guess, is to come back with, in SNAP and in other programs and in the Child Care Assistance Program, those tiered systems, what would they look like for you at the cabinet? And is that, is it doable? Can it be done?
I think with childcare, we could do it. I know the federal government does encourage us to have a graduated phase-out plan to specifically target the benefits cliff. That's not something that we had done a great job of prior to the pandemic, but is definitely something that we have requested additional information on, so that moving forward, that we can have those plans in place for when this ARPA money isn't there, to where that tiered system is there with the funds that we typically get with CCDF dollars.
Okay. So on the federal requirement, you're saying it requires to have an exit plan of a tiered system in a way?
It is highly encouraged.
Okay.
And I actually was just speaking with another state today about how they have approached that. So those are active conversations that we're having.
Okay. And another thing that was mentioned that I've overheard some is there do you guys have a report or any basic health plan or anything like that's being talked about, or maybe to help bridge some of that benefits cliff issue that it's going on?
I think our Department of Medicaid Services, that work is underway. We can get some more information on that for you.
Okay. Would it be something you guys could present on that to us for?
We could have cabinet representatives present the information.
On some basic health plans? Yeah, it's been, with this conversation, I mean, it gets into several things, and I know it's been mentioned, in conversations to me, and I was curious, if anything's been worked on, so.
Be happy to.
And I apologize, I'm kind of taking the liberty of the chair here to ask a few questions that I had additional, but I think that pretty well got most of those. Thank you, Senator Neal. Do you have another question, Senator Neal?
Just one.
Yes, sir.
Thank you. It appears that a cliff, a gradual incline of coming off that doesn't negate the incentives to seek employment and go further, but does not create a drop, which we're here about, is the answer. But doesn't Tennessee have something? Well, there's a state out there right now, and I thought it was Tennessee. It may be some other, but there's some model out there already, is my understanding. You may want to look around for that. I had a discussion a couple of weeks ago with someone else, and it was sort of a sidebar. But I think there's a model or two out there that you might want to look at.
Thank you. We'll follow up.
Thank you, Mr. Chairman.
Yes, sir. Senator Neal. Is there any other questions before we move on? All right. Well, Lisa, thank you so much.
Thank you.
Team, thank you. I appreciate it. And we're glad that you guys came to present to us today. A lot of good information, so thank you.
Our pleasure.
Thank you very much. Appreciate it.
Yes, ma'am. Moving along in the agenda, Emily Baumgard, if you would approach the mic and introduce any individuals with you for the record, and you may proceed.
Well, good afternoon, Co-Chair Dixon and members of the task force. We really appreciate you inviting us to be here today. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health, and I'm here with my colleague, Kara Stewart, and also with someone who is going to share her personal experience, Jessica Dixon, her personal experience with using benefits and experiencing the cliff herself. And so we really appreciate, the opportunity to be here today to talk about this because it really does affect so many Kentuckians. And as a coalition of consumer health advocates, Kentucky Voices for Health, our mission is to lift up the voices of Kentuckians and the decisions that affect their health and their well-being. And so hearing from people who have that personal experience, I think, is really critical. We also, as policy advocates, we work on addressing the root causes of poor health. And we do that, as I said, through policy. But, what we've recognized over the years is that while access to health care is kind of the area that we work most in, you can't be healthy if you are struggling with other basic needs like food, transportation, housing, childcare, as we've just been discussing. And so we're really grateful that this task force has tackled this benefits cliff issue for Kentuckians and Kentuckians who are working hard in really low wage jobs and trying to take the best care of themselves and their families. And so today we wanted to talk to you about 3 types of benefit cliffs and how each impact working Kentuckians. You've already heard a lot about one type of benefit cliff, the type that is on the far right of the screen, where people are working, have an increase in earnings, and are simply no longer eligible for a particular benefit, even though they may still be struggling with the cost of having to cover the benefits that they lose. But we also see 2 other pretty distinct benefit cliffs that people can experience regularly when they are actually still eligible for benefits. The first is accessing benefits when you're income eligible and trying to just actually enroll in that benefit. There's a lot of paperwork. There is a lot of verification that goes on, and some of it is verification that's essentially out of your hands, having to get an employer or a landlord to write a letter and do it in a certain time frame, sometimes 10 days. Short deadlines, processing delays, all sorts of things that keep someone from being able to access the benefit. We consider that scaling the cliff, and some people aren't able to scale it. Now, let's say, and we know hundreds of thousands of Kentuckians are able to access benefits, and they are able to, use those benefits to take care of themselves and to really support them in their jobs. But it can be hard to keep those benefits. So people face, during recertification periods, people face all sorts of barriers to keeping the benefit, if essentially the same ones I mentioned for the first cliff. But then you have fluctuating income and having to report that on a regular basis, having different income from one month to another when, it's just temporary change. Over the year, you would still be eligible, but sometimes you end up, having a gap in that benefit, and people don't always come back on. And then moving jobs and missing notices. These are things that happen to people frequently, and it's really destabilizing when you're in that sort of low-income position to suddenly lose your child care or your food assistance, your health care. And again, keep in mind, these people are still eligible for benefits. And then, of course, there's that third cliff that we've talked a lot about, which can happen when people raise their earnings. So, I think all of these cliffs make it harder for people to work instead of easier. And I know that that's, the goal that we all have. We all want to improve this situation for people and support them in working. And while I think that self-sufficiency is certainly the ultimate goal that I've heard from task force members, it's a goal that I think all of us have for ourselves and for our fellow Kentuckians. I do really want to put that in the context of the reality that workers are facing. And on the left-hand side of this slide, this is something you've seen before from KY Stats. This is their analysis of what minimum earnings are needed for a household to have self-sufficiency. And then on the right-hand side, you see what Kentuckians are earning. And most Kentuckians earn under $50,000 a year. That middle bar that you see there says 300,000. That indicates or represents 300,000 Kentuckians making anywhere between $35,000 and $50,000. So they're potentially on the edge of that cliff. And then the 4 bars to the left of that represent another 400,000 Kentuckians who are a lot further from being able to cover those basic needs with their earnings. So we're not talking about a small number of people, and I just think that we need to keep that in context. I mentioned earlier that people can be eligible for a program and not enrolled for a variety of reasons. A survey from the University of Michigan that followed families over a 6-year period found that most gained and lost eligibility during that period, and eligibility for SNAP specifically during that time. Sometimes they lost it more than once. And just for context, I think that the previous presenters mentioned the eligibility limit for SNAP, but it's 130% of the federal poverty level, which is far below that self-sustainability. And what's concerning about this is that fluctuating income, fluctuating above and below that poverty level or that 130% eligibility threshold, resulted in fewer families using the benefits even when they were eligible. So just that fluctuation and the going on and off of a program meant fewer people were using the benefit. And that indicates that people are probably facing administrative barriers to work supports. They may assume that they're not eligible because they weren't eligible for a time period. And some people may be facing stigma and just choosing for one reason or another not to use those supports. But these are people who could really use them. And while that was a study specific to SNAP, very similar administrative barriers exist in other programs. So I would expect that people would have a similar experience with fluctuating income in terms of childcare, Medicaid, Ccap, that sort of thing. So I mentioned earlier that people can be eligible for these programs, and this is the other data that goes with that study, where when you look at the fluctuations across lines, the more fluctuations you have, the less likely you are to use the program when you are eligible. And I just think that really indicates to us that we have too many barriers in place for families. And we can't not talk about childcare, but I know that you've had a lot of presenters already talk about childcare to this task force. And, I do want to note that the lack of available childcare, is not just an issue for individual families. This is something, that looming benefit cliff that we're talking about, which is kind of a whole nother type of benefit cliff with the federal funding that is, slated to go away in about a year. That's going to affect every family in Kentucky, whether you're personally benefiting from child care assistance or not. Your child care provider is going to be affected by that. And the fact that we have been able to slow this decline, so what you see here on this slide is that decline in child care providers just being available in Kentucky, how many we have operating. And so we've been on this steady decline for 10 years now. But, the American Rescue Plan Act federal funds have really helped to kind of stop the bleeding there and stabilize that for now. But there's just nothing that's going to stop it if we aren't able to kind of backfill that and continue to support these programs. And, what we've seen with increases in eligibility thresholds, which is fantastic. I mean, if you think about the number of families that are at or below 85% of the state median income, hundreds of thousands of families should be receiving child care assistance right now. They're eligible for it, but we just simply don't have that number of people, families enrolled in the program. So we've got a lot of families out there not receiving the help that they need and that they're eligible for. And I think that's only going to get worse. But the only other thing I wanted to mention related to that federal funding, it's done a good job of stabilizing, the centers that we have now, but not in starting new centers, not in really getting that additional capacity that we need. And so I'm going to pause here and ask Jessica to share her story with you, because everything that I've shared, I think, is really just the data that kind of would reinforce the story like Jessica's, where she's experienced some of these barriers herself.
Well, first, happy birthday. And I'm going to be brief. So I just want to take my situation of getting assistance. First, I would say the childcare was a very big thing for me because I have two daughters. One is 18, one is 8. And majority of my daughter 18, like 10 years, we struggle because if I made too much money, can you hear me? Okay, sorry. If I made too much money, that I would get cut off, so I couldn't get assistance because if I made too much money, so it was just a hard time getting childcare assistance. You had to make a certain amount of money, and so I couldn't get it, and it would take majority of your money out your check. So I would say childcare is a big thing for me of just even if you're over the slot, just having that a little assistance with childcare, because it would be majority of your check, and you still have bills, you got mortgage. So I would say childcare is a big thing for me. And then also, like, even the ladies before us, when they talk, I don't really know anything about that advertising of the help. It's not really a lot of people know about that, so they need to do better of just advertising the help and the stuff that can help single moms, because I'm a single mom with two daughters. And also just the whole, it's making it difficult filling out the paperwork. It would take a whole day just to get all the papers you needed for it. The system seemed just very confusing, and just a lot you had to do for the paperwork. But I would say just childcare was just really hard. That was a big thing for me, and medical. And then also I just wanted to talk on just if the people don't have the education, so okay, get assistance and then have the education to go back to school or budgeting, then it's going to be a continuous cycle. So I think that was the big for me. Like if you don't have education or budgeting, then people are going to continue to get on assistance. So just having that resources, because I went to school like 3 times and I dropped out because I didn't have assistance with childcare and stuff like that. So just outside looking in, just being in it, I would say just the cost of living going up, and just budgeting and financial literacy and budgeting. So that's...
Jessica, were there any particular moments with documentation that stand out to you, like they would ask for a lease or
well, I own my house, and they would ask me for my lease, and then when I give them my lease, they said it's not enough, my mortgage, and then they would say that's not enough, like you need another document to say that you actually own it, but my name on there and everything. So it was just like really like it just made it harder to get assistance, and then you struggle because it was just so hard and you just didn't go through it, or you had to take off work. And so I would say that it was just really hard, and me and my family struggled a while, but now I have a better job and I'm salary position, but we struggle a long time, and I still need like childcare assistance because I said like far as needing childcare, I have an 8-year-old at home, and when you get your check, that's majority of your money. So just having that financial literacy, education, having it easier to fill out the paperwork, and not making it so difficult, because it just seemed like it was just a lot that you didn't need. So
even with all of the challenges, Jessica, do you think you would be able to own your own home right now without having assistance to those benefits?
In the beginning, no. Now I have a better paying job. So I work for a nonprofit now, but before it was just really hard to finish school. It was just really hard to want to do better for yourself. And like I said, the ladies before, they had said something about the jobs and the opportunities, but nobody really know about it. So I think they need to do a better thing of like advertising the help that's out there, so the people can be on the benefits and then get off. Because I never wanted to be on it, because it was just a pain, just the paperwork and all that. I wanted to do better, but it just seemed like it wasn't no other option. So you just kind of took a lower payer job. But now I have a better paying job and I get the Medicaid, but it was just really hard. So
I have a
question.
I have a quick question for you,
Okay.
if I may. Did, not to continue to harp on a tiered system, but from your experience and having firsthand, do you feel in that experience that having tiers and some of those benefits would have helped you, or maybe even, increased the timeline of what you would have used those benefits to get you to the point you're at now?
Yeah, I think so, because it was one point in my life when I was getting the benefits, and then it was like you made too much, so you couldn't get childcare. So you took a lower paying job, because if you took just a little more, you would not be able to take care of your family. So now it's just I had to just work really hard, and of course you should anyways, but it was just really hard just getting the benefits and the assistance. Just the whole process was just hard. I was just $1 over or $100 over. And so I think just having a better way of filling out the paperwork, and then just having other resources of, showing the people how to budget. Because you can give somebody benefits and extra money, but if they don't know how to budget, if they don't have the financial literacy, if they don't have education, then that's going to continue to go. So I think I had to push through that, and, so.
And Chair Dixon, I can respond to that with someone just from this week who just got offered a team lead position at Toyota, which was a $2 an hour raise, but that makes her ineligible for SNAP, which of course I know you all have heard before from other people sitting in these chairs, that $2 per hour raise does not replace the SNAP support. That takes $10, $12 an hour to replace that SNAP support. So that person's down in a position where, sure, that job pays a little bit more, but where would that lead? And would she be able to become the floor leader? Would she become a manager? Well, you're not going to make that jump one at a time. And so now what position is she in? Does she choose to not have enough food for her family and take that in the hopes that she gets another promotion down the road? Or does she not take that promotion to make sure she can continue feeding her family right now?
We have a number of recommendations that we wanted to present to you. Before we do, I also wanted to mention that I think yesterday you may have received a letter from Matt Reynolds in Henderson, director of Habitat there, and he really wanted to share stories from some of the folks. Oh, excellent. Some of the folks that he works with and has seen how these work supports.
Emily, I don't think your mic's on. I apologize.
Thanks. Has it been on at all?
They were being very quiet and respectful and listening.
Okay. So Matt Reynolds from Habitat in Henderson has seen how these work supports benefit the people that he works with every day, and was just really, really enthusiastic and wanted to make sure that you all were hearing from him. We also had another single mom who wanted to join us and share her story, but she was going to join via Zoom, and I'm not sure that is available today. So we'll make sure to get
What is
it
that?
is. Oh, fantastic.
Oh.
Is she on?
Yeah.
Just came back.
Oh,
It
great.
just came back on. That was
Well-
a delay in the beginning of the meeting.
Yeah, we
but-
sort of called her off, and she's sitting by her computer, I think. But
We'll text to see if she can get on.
um,
And in the meantime, I wanted to mention too that this the next couple of slides, there should be a handout in your packet that shows kind of a snapshot of this social services study that's been ongoing from a researcher at Cornell University. You wanna take-
yeah, I texted Keisha Curry, who we were anticipating testifying over Zoom, after I'd sort of called her and said, hey, the internet's down. So she's on standby. And until that time, again, I'm Kara Stewart with Kentucky Voices for Health, and I'll go ahead and talk to you just a little bit about this study from Cornell University that's currently ongoing. So I'm very happy that Kentucky snagged this. It was happening in North Carolina and a couple other states, and we were able to snag this. So we've got Dr. Jamila Mishner, who is brilliant, doing interviews with Kentuckians who are receiving benefits and our workers. So that way we know that on both sides of that telephone, on both sides of the coin, what's going on and what we have learned from the study thus far. So the study's not over, so you all can be excited and wait for the final results, but we are giving you this sneak peek, which you do have in your packet, that she's already talked to almost 150 beneficiaries. And she hired Kentuckians to do the interviews with the beneficiaries initially, so that was also some good flexible jobs. So we've learned a lot, though. We have learned that it matters. Of course it matters at the end, the cliff we've all talked about, but it also matters on the way in between. And people simultaneously, I mean, you may have heard it from Jessica, there is like a profound gratitude for work supports that make it possible to work, and there's still frustration with sort of how difficult it is to maintain those work supports. And I say work supports for our public benefits programs because the majority of people enrolled are working. That is just a repeat, and I could say that could be my entire presentation. The majority of the people are working. They are working at low wage jobs that don't pay enough to pay bills, which of course you saw in Emily's slide earlier, and I know you've seen from Kentucky Stats before. We've got a huge number. The majority of Kentuckians aren't making enough money to survive. And we're looking for Kentuckians to thrive, of course. All right, I haven't heard back from Keisha yet, so I'll keep going. These are quotes that I would love for you to take the time to spend with. They're kind of long. I'm definitely not going to read them. But we also have, outside of this study, we also have another good news sort of opportunity that I know I've spoke to some of you about, and some of you may remember. So in 2014, we were a part of a federal pilot. Anybody remember the Paths to Promise? So Paths to Promise was in Senator Wheeler's district. So it was in counties that have been experienced generational poverty. It was 8 counties in southeast Kentucky, which you can see there. And it's not all your district, Senator Wheeler, but it includes part of it. And what the Paths to Promise did was, let's try adding on extra wraparounds. Let's see what happens if we say, instead of just enrolling in these individual programs, if you enroll in one, we're going to use we're going to make sure that you're in more programs, and we're going to add a case manager, and we're going to add financial counseling, and we're going to add one benefit that individuals talked about a lot was mock interviews and interview close. There were several qualitative results that came out of the Paths to Promise pilot that referenced interview close and mock interviews. So people are like, hey, even if I can go get a job, I can't go get a closer to a white collar job if I don't have clothes to wear to that interview, and what a barrier that could be. And this program included transportation for childcare and childcare assistance, and the results. So if you go read, this is a video which, now that we have the internet, might play. This is someone who was participating in the program who I'd rather you hear from than me. Also, despite my gravel, I took 2 COVID tests. I just choked on a chicken nugget the other day.
It's not going to play.
All right, video's not going to play.
Well, let me just point out that at the bottom of this slide, if you click on any of those counties, you will see their videos. And so there's a video with stories from different people who participated in the program and who were also staff supporting them.
Yeah, so each of those counties, this happened in lots of states. We weren't the only state. It happened also in Virginia and in California and in Vermont and some other states. And what we learned is that, so 36 months was the minimum to see a statistically significant change. And in Eastern Kentucky, 36 months wasn't quite enough. So, but we still saw the individuals overwhelmingly reported positive experiences with ability to maintain employment, with ability to increase employment, with these extra types of exported activities. Now, the federal government, their kind of overall was, this was sort of an unworthy investment, despite the fact that it was an excellent investment for the individual. So the individual perspective was different from the federal government perspective, because the feds were like, we don't want to have to pay this much to get people to self-sufficiency. Well, maybe you don't, but maybe there's no other way. Right? Like, maybe I can agree with you that you don't think that's a great deal, but no one's come up with another path. And this path was a way that did produce people becoming more self-sufficient because they had enough supports. And sort of what the takeaway I want you to hear is that a little thing here and a little thing here ain't enough. You got to have a whole lot of pieces when someone is living at a $10 an hour job where they're working, they're getting our health care. Transitioning to a $12 an hour job does not do it. I know you all are a broken record and you've heard this. I deeply appreciate your question about the basic health plan and the tiered. There's only so many solutions here, and those have got to be a part of it, I think. I think you've hit onto that accurately. And here, sorry, I'm not hitting the next slide. And then, of course, I brought this up to other folks in the legislature before. This study commissioned by Governor Kasich, come back up, and it's gone. Okay, so and it's back. Republican Governor Kasich in 2018, and it's ongoing. Well, he did it twice. Did a study about the impact of Medicaid expansion, and that's our neighbor in Ohio. obviously they've got more people, but it's not that crazy different. And they found overwhelmingly 9 in 10 reported that Medicaid made it easier to continue working. And the majority of unemployed enrollees said Medicaid made it easier to look for work. So Medicaid is a work support, and I hope you all saw the Brookings study that just came out that showed that Medicaid is also a public health and crime reduction. So states that expanded Medicaid saw a reduction in crime relative to states that did not. So I hope that's already come up in other places. Not the most relevant for the Benefits Cliff Task Force, but I just can't help but point it out. And these are pretty dramatic numbers. You want to comment?
I was just going to say, we didn't have a slide on the basic health plan, but what I'll tell you is that and how it relates to the benefits cliff. With Medicaid, the income limit for most adults is 138% of the federal poverty level. So if you go above that, then you can probably either get coverage through your employer or shop on the marketplace on Connect and find a qualified health plan that's subsidized. What ends up happening, though, is that the cost sharing, whether it's the premium or the deductible, the copays, the coinsurance, is so expensive that people can't use it. If you think about someone who's still in that income bracket, between 138, 200% of the federal poverty level, that's just a cost that you can't really, afford. You can't budget for that. And of course, if you're healthy today, you're going to, maybe pass up health insurance to pay for your rent or for your utilities, anything else that is a little bit more, urgent. And so a lot of people end up going uninsured. And what a basic health program would do would be to provide a new option for people in that income bracket. It could go up to 200%, but it could even actually go up further than that, depending on how the state chose to do it. And provide plans that don't have a deductible. So there would be a minimal premium, there would be some small copays, but there wouldn't be that deductible, which is what keeps most people from feeling like their insurance actually works for them. So that's our pitch for the basic health program, which we think could be a real, and this is something that was covered, I think, just last week in the Medicaid Oversight and Advisory Committee, and you'll probably be hearing about it a lot this year or this upcoming year. People have been enrolled in Medicaid during the pandemic and for the most part have stayed enrolled in Medicaid because of the federal public health emergency. And so we have about 1.6 million Kentuckians covered by Medicaid. About 200,000 of those individuals will need to actively renew their coverage because they may have income that's higher than the eligibility limit now. We're not sure until they actually document that. The cabinet is looking at, 200,000 people who some will continue to be eligible, we would assume. Others will have to find other coverage. And, that's a lot of people who could become uninsured overnight if we don't have a more affordable plan in place for them. So the timing of a basic health program is also really essential here.
Crucial. And one other basic, I'm going off script because the chair brought this up, so it seems irrelevant to follow up with it. The other element there is the network. So right now, if you come to me and Senator Neal says, okay, I got this bump in my job, so I'm no longer eligible for Medicaid, and I can be like, don't you worry, I can enroll you through Connect with a plan with probably a $0 premium if you haven't gotten too big of a raise, but you are going to have this deductible. And oh, by the way, you can't still go to your same doctor. All your doctors are going to change because I can't find you a plan with that same network. The basic health plan, as it is being strategized right now and evaluated, it does include the MCOs being required to, or not required, that's the wrong word, incentivized. Strongly encouraged to offer the same networks that they already have. Therefore, when you make that move, again, it's still usable because of the deductible. And I think even more importantly, you can keep your same doctor so you can maintain that relationship and that continuity of care, because we know that continuity of care produces much greater health outcomes. And even just waiting to get in to see a new doctor, even if you're covered, even if it's 0%, is going to be a significant delay, because a new patient, y'all know, takes a lot longer to get an appointment than if you're already in that care team.
And I think we've now bought ourselves enough time that Keisha is on the line. She says that the committee room is muted. I'm not sure if you all can see her or hear her.
We probably have, we'll get her up and let her give her testimony, and then we may sum it up, and because we've got several questions that have popped up.
Yes, sorry.
I need to switch this all around.
Questions are the best part, right?
While we're waiting for the Zoom link to come up, I will share, it was brought up by Emily. I did have Matt from Henderson reach out, and it's probably a good segment to bring this up while we're getting the Zoom link open for your individual there. There was a young lady, I'm assuming a young lady, but a lady in my district that had 2 kids, and she wrote a letter to me, and she's a constituent of mine. And I just wanted to point out just a couple things that she kind of summarized in her letter of what she's dealing with. And she goes on to say that she was trying to work, gain an hour or two. She had 2 kids, that she was looking for a better job and searching around our community to try to better herself. And I just want to point out one statement. She said, "I never minded that I lost a benefit or a portion of a benefit for the money earned, for the additional money she would earn. But she said, I just wished it would have taken longer to phase out. As I raised my income, I would lose the benefit that would far outweigh the cost of that dollar raise." So I just wanted to point that out a little bit, and you had said that, Ms. Dixon, kind of the very similar point. So I think that's kind of important point to bring up.
Yeah, I mean, I'll say as a person who's done enrollments since 2013, I've never had a client not take the raise, even if it was going to make their life harder.
Right. Do we have the Zoom link up yet? Okay. Well, we can move forward with that presentation quickly.
Keisha, are you there?
I'm here.
All right.
All right. Miss Allen, if you would introduce yourself for the record and then proceed with your testimony.
Keisha, that was to you. Keisha Curry is here from McCracken County.
Oh, I'm sorry. I was looking for my notes. So I can't find my notes. So sorry. My name is Keisha Curry, and I am a resident of Paducah, Kentucky. A very, very proud resident of Paducah, Kentucky. I'm a proud resident of 2 now adult grown boys who are just very good citizens. And I just wanted to say that I currently work as a social service director float for senior health care. I've worked in various areas of social work where ranging from child welfare and adoption to HIV/AIDS, traumatic brain injury, and all other areas of social work. And I'm saying all this to say that I am a product of public service, of public resources. I have benefited from public resources on several different occasions. A lot of occasions I found myself, close to being homeless, hungry. But if it had not been for the community around me and public resources, I don't know where I would be at this point. I am proud to be, I guess you can call it, a survivor of no, go back to say a product of public, and excuse me, my notes are all gone. So I just want to say, if we're going to talk about public service, public resources, we have to talk about not just trying to rid people of public resources, but more so building a bridge and transitioning people. If it had not been for public resources, I don't know about child care. I wouldn't have had child care. I wouldn't have had benefits for my children. Because of Medicaid, I had Medicaid. My son was diagnosed with multiple sclerosis at the age of 18. If we had not had any health insurance, I don't think we wouldn't even know what his diagnosis was to this day. I've had to have my kids grow up early due to the inability to have child assistance.
Keisha, can you still hear us?
Well,
Can you hear me? I'm sorry. Can you hear me now?
Yes.
Oh, I'm sorry. I apologize. I'm here.
okay.
You want to hang around for questions in case, let's see if the committee has any questions for Ms. Curry or Ms. Dixon?
Oh, yes, yes. I can stay for questions. I'm sorry. I don't know where it blanked out at.
You're all right. Thank you.
All right. So if we may, we'll move on to questions. We have several. Senator Nemes?
Yes, thank you, Mr. Chair, and thank you, ladies, for your testimony. And young lady, Miss Dixon, is that it?
Yes.
I admire you for raising 2 children and trying to better yourself and show them a better life, how it can be. Now, we talk a lot about the income, the increases in the benefit cliff, and I've always said that we should tear it down instead of just take it away. Also for unemployment insurance, which we're not handling at the moment. And we talk a lot about child care. You can't go to work if there's no one watching your child. I'd like to see, Mr. Chair and committee, more of education and training. For instance, if we could have the wraparound services for you to go to school or to apprenticeship program to better yourself, so that you wouldn't be taking just $1 an hour extra at McDonald's or somewhere, that you would get the training, which you have tried. The education and training, so when you get through that, then you're already off the benefit cliff because you're already making a good amount, and you're an asset to yourself and society and your children. That's where we need to go, more so than just helping you get along with the small jobs that you can get now, so that you can make a decent living. And wow, I'm just amazed you have an 18-year-old.
Yeah.
She don't hardly
She's
look
going
18.
to EKU to be a nurse.
I mean, you barely look 18. You're sure weathered the years better than my good friend Senator Neal, who looks like twice the 39.
He's 39.
Yeah. Well, he looks twice that. So, but thank you for coming, and thank you for doing everything you can to better yourself.
Yeah, thank you.
Senator Nemes, we have significant ENT programs, employment and training programs, but I will say that there is several pilots that were done, and FNS released a study that said that basically one statewide program is never going to cut it, because we have radically different outcomes in our urban regions versus our rural regions, and so so we need to come up with different approaches, a
You're
multifaceted
exactly right.
approach.
I was in the labor cabinet, and we did a lot of registered apprenticeship programs, and we reached out to felons and to veterans and to addiction recovery people that were. It would be great if maybe they'd also reach out to parents that are struggling.
Yeah, the opportunity's there.
Yeah.
For the state.
All right. Senator Wheeler?
Thank you, Mr. Chairman, and obviously these programs are incredibly complex to some degree, and I do believe that's part of the problem. And I agree with my other colleagues here that we need to do a more tiered down approach. What, in your opinion, is particularly, obviously, the health insurance is a big thing, having that security to know that your family, if something bad were to happen, has a fallback position. But I think we're dealing to some degree with a lot of younger people here that may not have as many health issues. Is that a primary impediment to advancement? I can definitely understand the cause for some basic coverage, but is that I guess the biggest benefit cliff that we have to worry about?
Oh, child care. I would say that child care is the biggest benefit cliff. I don't want to mislead anyone. In fact, we were trying to explain that while the healthcare has the least benefit cliff, it's still a very real one.
Sure.
And it's like maybe the easiest solvable one because we already have a solution created, and it's just a matter of the timeline with it existing. You all put it in the budget last year to create it, so it's just a matter of getting that out in the real world.
And child care is this primarily, I guess, looking at the newborn to 14 or
12,
15, 12, yeah, okay. All right. And is there anything you think we could do to try to incentivize, I know we lost a lot of centers during the pandemic. I know a couple of in my home region suffered. I mean, one of my fifth grade teacher, I guess, had invested in a child care facility right before the pandemic, and I mean it was tough. I talked to her many times, and she had some struggles, and she also indicated to me sometimes dealing with the cabinet as an operator was not the easiest thing to do. What types of maybe assistance that we could give not only to people who need child care, but to maybe incentivize the creation of more qualified child care providers? Do you think that we could do maybe within the cabinet or even through legislation?
So interestingly, starting July 1st of this year, we have a heck of a program available. We have a up to $100,000 match to start a child care center available through the ARPA money right now. Now, I don't know as of today, but as of about a month or so ago, we'd only had 2 people take the state up on that. And there's also an apprenticeship program with it now. So I've got a lot of question marks about how Jessica said people don't know about these things. Maybe people don't know because we have a lot of informal childcare happening out there. There's a lot of, especially, aunts and grandmas and retired folks that are providing childcare who, why can't they be getting paid for that in-home childcare?
I think a lot of people are also looking at the temporary nature of that funding. And if, childcare providers or potential providers were to see that the state was investing money and had, more funds was investing money and had more funds invested, ongoing into the future, taking that risk would be easier to do.
A brief follow-up for me, Mr. Chairman. Obviously, I guess there's, of course, this incentive, which that's the first I've heard of it too, sounds like a great thing. And I honestly, that, a lot of them can retire at 55, which, still leaves a lot of good time to, they have these skills that they've gained through their years of employment, which would still give them a lot of time to contribute to the community as they get older. I guess is the idea behind the match to kind of, I would think at some point once you get the match, at some point we wouldn't have to necessarily continue to maintain that match, because the idea, right, I guess, would be sustainability, kind of like with all these other programs, correct?
Yeah, so that part of the program is not something that you would need, in theory, for years on the road. One of the other challenges is finding skilled workers, because turns out childcare is not an unskilled labor. And so you have to have people who are trained. And there's also an apprenticeship program currently that's also available because of ARPA for the next couple of years. But again, we haven't had the uptick. And part of that isn't people knowing. You're not the first person who wasn't aware that it existed. So that's part of it. And the other part is the regulations in childcare are significant. And so there's fear, right? And of course, like Emily said, there's a big fear of that this is going to be abandoned as soon as the federal money's gone because there's not the support. And we, again, know that half of Kentucky is a childcare desert. Half. There are not enough childcare providers, period, right now. It doesn't matter how much money you're willing to pay. There may not be a slot for you.
I'm currently taking night classes at BCTC, and I had to bring my daughter to class the other day, and I didn't have childcare. So it's really a big deal. Like, I have no family here. My family's in Michigan. So it's really like childcare. I would say once you get childcare taken care of, then you can get education, and you can get that, and then you can do better. I feel like it's just a lack of education, a lack of resources, because it just make you just like, oh, what's the point of trying? So you just keep trying, but it's just like, I would say the childcare is the top, and then Medicaid, the insurance. So
I would like to add something to that. Is that okay?
Mm-hmm.
In addition to the child care, a lot of us, like for me, I had to work 2 jobs with my 2 boys, and they had to be latchkey at grades third grade and 7th grade. So that's not always a safe situation for a lot of people. I didn't have any family around. So child care is definitely vital in order for us to make it from day to day, much less get further than where we are.
All right. Well, thank you.
Nobody's mentioned that, right, you all?
Yeah.
I'm just kidding.
Senator Wheeler, was that all of your questions, sir? Yeah. All right. Senator Neal?
Really, this is really quick. It seems kind of obvious. I just don't know. You keep raising the point about education and people knowing about these various things that are out there. They're not being taken advantage of to the extent you would expect. That seems to me to be the responsibility of the department.
Oh, for sure.
But the department is a complex animal, and I just wonder. And I'm just throwing this out. I'm not looking for a response. That the department, perhaps, if they do not have that, should maybe re-examine that to see how each of their components communicates availability and accessibilities of certain programs, and in what form and what methods and what in a regular fashion, et cetera. I'll just leave it there because they may even have it, but I think it probably needs to revisit that. And I'd ask those that are here who gave an excellent testimony today to make that part of their take back. Mm-hmm. Thank you.
Well, Ms. Baumgard and Ms. Stewart, Ms. Dixon, and Ms. Curry, thank you all very, very much for being here today and to providing all of the good data that you provide. And then Ms. Dixon and Ms. Curry, thank you so much for coming and providing, I think, is valuable testimony to hear from constituents of ours across the state that deal with these issues firsthand and how you've overcame those issues. So thank you so much.
Thank you.
With that, we have one last presenter, Paul Gronowski. If you could approach the mic and introduce yourself for the record, and you may proceed. And Paul, a million apologies if I did not pronounce your last name
Smith
correctly.
That's fine. All right. Paul Gronowski. I am the Director for Workforce Development and Solutions for Audubon Area Community Services. And we are one of the largest of the 23 community action agencies here in the state. One of the largest in the country. And what is community action? Well, we are the voice of the poor because we work specifically with low-income individuals and families and help elevate them out of poverty. Poverty is a big question for us. We talk poverty in every scenario and every situation that in all of our programs on a daily basis. So today, I'm standing between you and your families and getting home. So I'm the closer here. So I'm basically going to be talking about the SNAP Employment and Training Program. It was mentioned a few times throughout the presentations. We're one of the providers in the state that provides this training. We've been providing SNAP ENT since 2019. And we also manage the TANF program too, which is kind of similar to the SNAP ENT Employment and Training Program as well, since 2007. And we manage those in 34 counties here in Kentucky. So we've been doing this for quite some time. We have a wonderful relationship with DCBS and CHFS as well. And my presentation is basically about our success factors in becoming a successful SNAP ENT provider. This was sanctioned by Director for FNS. Because we're part of the national cohort with Community Action, and a lot of these things that we cover in this success factors is something that they are talking about and proud of. So this is basically the agenda here. It begins with the intake, and again, this is once they enroll into the benefits. The state refers them to us, and so our agency takes everybody that gets referred to us. And so our job is to collect a lot of information. In fact, we collect a lot of information and have a lot of data to provide. But this is that point where they try to figure out why you're here, why you're on benefits, and talk about their employment plan. What do they want to be when they grow up? Is kind of how we refer to that. So we use a lot of data collection methods. We talk about a lot of different things with them, and so through that whole process, we try to help identify. We use this term, identify successful enrollees, because we want individuals that come into the program, what's the best outcome for them based on their need and based on their goal. And then once, during that process of that intake, we do, and I have some samples of what our assessment is. We have, like I said, we have several assessments. If they come in and they don't understand what they want to do, because, our job and our part of our contract is to get them off of the benefits into that self-sufficiency, try to be in that self-sufficiency plan, and into a job. So, we're asking a lot of those questions. And part of that process in our assessment, we use this Rasnick test that kind of points to when they were like, I don't know what I want to do. It kind of paints them a picture as to a direction as to based on, do you like to talk to people? Do you like math? Do you like these different situations? And so it paints them into something that they would enjoy doing. And so we take a lot of that information into account. And plus, we look at what they did before, where they are working, if they're working, their skills, their current skills, and what their skills that they need based on their employment plan, what they want to do. And so, we address their right now economics is how we term that, because everybody's on there for a reason, whether it be they're, running from an ex, or, they're somebody passed away, or, whatever situation it is, we're there to talk about, how do we solve that? And of course, we have to address a lot of the barriers. We talk about barriers, throughout today, and of course we talk about barriers on a daily basis with them, because there's a reason why they're on the benefits, and those are those barriers to employment. And so those barriers to employment, like child care, transportation, substance abuse, them being pregnant is also one of the barriers to be on our program. So, child care and transportation represents a third of the barriers that our individuals talk about. And so those like many, we want to take the family in consideration when we kind of take on this on them as a client into our program. And so, just like COVID kind of slowed a lot of things down for us, but COVID is now over. But during COVID, we would offer healthy eating tips, exercising tips, and everything for that individual and their family to stay focused and stay, even though they didn't have to participate at the time. We gave them opportunity to be, at least try to be healthy and successful when during the pandemic. But we also at that point, when we talk about these skills, we're preparing them for their placement into the program, and that's we talk about successful placement. Part of what we do is unique to a lot of different agencies throughout the state that are providers for the SNAP E&T program. We have this personal effectiveness skills training, which is from the Department of Labor's Mastering Skills for Workplace Success. And it's basically, your self-management, which talks about attendance, professionalism, punctuality, your job performance, which talks about, your how do you follow instructions, meeting deadlines, and focus on safety. And then your team performance, which is communication, how to communicate with other coworkers, and if there's a situation, how do I communicate with my boss? And of course, the asset to the organization talks about your adaptability, right? We want individuals to be able to adapt to changes in their job. Talk about focus on quality, and of course, being a self-starter. We want people to be motivated and things like that. And of course, all of our personal effectiveness training is work-based learning. Okay, there's some agencies out there that talk about boot camps and soft skills and all this stuff that they sit in a classroom for a day, an hour, a day and a half. all of our training is work-based learning. There's nothing else. There's no classroom other than when we talk about our employment readiness training, which is a added benefit to this as well. So once they achieve their personal effectiveness, their PES training, they move right into their specialized skill training. And so we provide certificates for a lot of different things, a lot of different skills for individuals. You know, some of the most popular ones is, we have a lot of retail individuals who go through our program and out the door. Customer service, we have warehouse workers, we have daycare workers. We have a lot of different. We have over 50 skill certificates that the individual can learn through that work-based learning. And once they get established through that work-based learning, and then they get into our employment readiness training, which is our job focus, interview skills, time management, financial literacy, a lot of different how to do job searching. And throughout the time that they're on here, we provide job leads to them on a daily, week, and monthly basis to individuals based on their skills, based on their needs, based on their wants. And, we still have people who are off the program that still request some of those job leads that we provide, because it's just not, we don't just say, Lowe's is hiring, we're going to send Lowe's application to everybody. We have a specific plan for each specific client because their needs are all different, their skills are all different. And so each one of those job leads are based on that skill, and we kind of walk them through them. And we provide that interview training. We have some had some videos of individuals who do the sample mock interviewing. We have some businesses that come in and help with that process too, so that they can understand how they sit, how they stand. And so we videotape a lot of those things to make sure that they see exactly what they need to see to be successful when applying for jobs. And of course, we have a strong, I pride our staff, because without them, I'm just another employee with our agency. But we have empathy training for our staff. All of our staff go through empathy training, because it's an important piece to understand the individual sitting across from you. We work in this, we talk about this synergy too. We want to combine our wraparound services to a lot of our individuals to ensure that they're getting a lot of the need and our fairness and to drive the success of that individual, because our success is their success and their success is our success. And of course, we evaluate our staff on a monthly basis based on our productivity and things like that. And so once we also talk about our engagement with employers. Okay, we talk about meeting the changing needs of the client, because we have a lot of clients that say, I want to be a vet. I'd like to be a vet, and so we place them at a dog shelter, for example, and they're like, I don't like cleaning up dog poop, so I don't think I want to be a vet. And so their change, their employment goal changes from time to time. And of course, the demand of a workforce changes. We went through this pandemic where, things were, oh my gosh, we've got to try to figure out how we're going to work from home now. And now we're not working from home now. And so there's a lot of different things. We talk about this, a lot of the pressure for putting people into the STEM jobs. I think I provided some information. We have quite a few people that fit that category, but there's a lot of individuals that go through our programs that, factory work and working in some of those type of jobs just isn't what they are looking for, even though we do have discussions and talk about that. Let's see here. And of course, we, part of that, collaborating with businesses, it's a requirement for all of our career coaches to have engagement practices, engagement strategies for their communities that they service. Like I said, we're in 34 counties. We have over 2,000 employers that we have touched and are part of in those 34 counties that we serve. And part of that, we do a business survey. We ask a lot of the questions to those businesses specifically about, how's your turnover? What kind of jobs are you looking for? What's your turnover cost? Because turnover cost is a big thing for these employers, and we want to make sure that, because we deal with a lot of mom and pops as well, not just big businesses. So we have that discussion with all businesses about turnover. What's your cost? Do you understand? How are you keeping them? What kind of backgrounds do you accept for individuals? Because we have a lot of individuals that have questionable backgrounds in our program. Wage compression is another big issue going on today. We have a lot of businesses that raised all their wages for new hires, but the top end, didn't get a whole lot. And so, this wage compression thing is a good short-term fix, but in the long term, you're going to see a lot of movement with individuals moving jobs because of the fact that there's lack of appreciation with that. And we also talk about benefits as well. Part of what we've been doing for years now, and I'm talking years with our TANA program. We ask, do you track people who miss work? And one of those questions is, do they miss because of childcare? And so we've been talking about the trying to bring on that business aspect of the childcare for years now, talking about how they can, utilize the, maybe offering that, paying a little bit of that tax, paying a little bit of that childcare for that individual, and focusing on that tax break that they would get doing that. So we've had discussions prior to COVID with a lot of businesses with little, little kind of, it's great. We understand that. But, since COVID, a lot of daycare centers are no longer around. And so now we're getting a lot more response from these businesses to have those discussions with them a little bit more. And then, of course, we collaborate with other workforce programs. So if they need additional training, additional skills, different certificates, expungement or whatnot, we have a lot of other programs, and we tackle that with through a lot of the other workforce programs out there. We're not just the greatest person or greatest agency. We have some faults out there. So, and of course, we also partner with a lot of our community partners as well. So, if they need help finding, clothing for interviews and so forth, haircuts for job interviews, and all that stuff is all, we collaborate with a lot of our community organizations to build that wonderful relationship for our clients. So this is all client driven. Everything that we do is our client driven, so that they can, be successful in gaining employment, because that's what we do. And of course, this is the most important piece of what we do. Our contract specifically states that, we have to have so many people go into a job. And so, part of what we do is, it's not unique to the state, but there's a lot of different things that we do that some other programs may or may not do. Again, we do a monthly follow-up with every individual for a year once they stop receiving benefits. And through that time, we assist them with, challenging, maintaining employment stability, which basically means, don't quit your job. If you don't like your boss, you don't like your hours, you don't like where you're at, don't quit. Let's find you another job, and we'll provide a lot of those services so that they can maintain that employment stability. We talk about, skills to build and promote career advancement. And so, we also, talk about, what can we do based on your skills? Here's some information, update your resume. Here's some information that you can take online after work hours and so forth to get that career advancement. And we also provide information to all of our clients about the earned income tax credit that they're eligible for. We provide employers with that work opportunity tax credit, which is easy because it's online. A lot of different things. And so we're not tax accountants, and so we don't tell them exactly what that tax thing is, but we do have a tax calculator from that work opportunity tax credit that kind of gives that business an idea as to how much tax that they will, based, because that's state run there. And of course, once we have our program, we evaluate what we do on a yearly basis to ensure that we're providing the best quality service for our individuals once they leave the program. And so I provided with you some testimonies from individuals. We did have our let me see where they're at. Mr. Maybe it's in this packet. Yes. Donald Brewer, the number one person on that list right there, was one of the several people that were going to Zoom in, but he was obviously working, so he could not make this meeting. But we have a lot of testimony throughout the years. In fact, all of our staff members, all of our career coaches have what we call as a kind of a wall of fame. That when an individual gets referred to our program, they walk in. What's unique about us is that we're actually housed in the DCBS offices. So when that individual gets referred to our agency, they're walking them across the hall, which there's no cost, which compared to some of the other agencies where they actually have to drive across town, figure out transportation, how do I get there, and all that fun stuff. So we're kind of unique in what we do. And that individual can see on that wall of fame some success stories of individuals have earned their certificates, earned jobs, thank you notes, and all those cards, so that individual feels comfortable walking into our offices about seeing how successful somebody can be, which sets the tempo for them. So, but again, we have plenty of success stories that talk about the SNAP ENT program and how beneficial this program has been to them. And these are just a few. I mean, we have, just about everybody that's been on a job, is so thankful because of the fact that, somebody gave them an opportunity and we, held their hand throughout that whole process so that they can be successful. Are there any questions? Because that's...
No. Thank you, Paul. If that concludes your testimony, Representative Pamela Stevenson, you have a question?
I'm sorry, I might have missed it, but did you say how many people do you serve?
We're in 34 counties, and we served approximately in 2000 through 2022, we served 230. And that's because of the pandemic, so there's not a lot of participation going on at the time. So,
thank you.
You're welcome.
Does anyone else have any additional questions? Okay, Paul, I've got a quick question, real quick.
Sure.
And so your funding is half. We were just talking about that. It potentially, correct me if I'm wrong, maybe half state, half federal.
Yes.
Okay.
I believe
and
so.
then on your services that you offer, capacity, you could take more.
Oh, absolutely, absolutely. Yeah. We, back when TANF, like I said, is very similar to the SNAP ENT program, and we had thousands a month on our TANF program back in the day.
Mm-hmm. And then I think it was mentioned in your presentation, success rate, when you get individuals that come through the program on the backside. Success rate, did I catch that?
Yes, we average about 96 or higher % job retention rate. So when somebody gets a job, they stay employed. And majority of those individuals that get a job are, above the poverty rates. They're not, $40 an hour jobs, obviously, but they're in that 20. We average somewhere close in that $20 an hour range, which is kind of pretty good considering where they were prior to coming in. All these presentations talked about that. That's right around that $47,000 a year, which is where the majority of the jobs are. Unfortunate in our communities is that those are the jobs, that and lower. A lot of those higher paying jobs just aren't at access to rural communities and that we serve. So.
And then with that high of a success rate, my final question would be individuals finding out about your services in your program.
Well, that's part of the the DCBS has training through with all their career case managers and all their intake people. The connectors through the Health Benefit Exchange is also going to be helping to enroll some SNAP individuals, and so we're going to get the SNAP ENT information out there because it's a volunteer program, and so not everybody has to participate at this time. So we are advertising that, at least in our 34 counties, through Facebook and through social media and a lot of different areas. And our flyers are everywhere in our 34 counties.
Okay. If no one else has any other further questions, Paul, thank you so much for presenting.
Thank you.
Appreciate it very much. Senator Neal has skipped out, but I'm going to wish him a happy 39th birthday since I did not know to begin the meeting that today was his birthday. Our next meeting of the Benefits Cliff Task Force will be on October 20th at 3 p.m. In this same very room. Appreciate all the presenters today and all of the senators and representatives on the task force for being in attendance today. Thank you so much.